Hi guys, so what is functional medicine? Well, it's really an integrative systems-based approach to finding out the root cause of an illness. So how do we do this? Well, if we contrast it with conventional medicine, which just looks at each body system independently of each other, meaning you have a heart doctor, a lung doctor, a kidney doctor, functional medicine will actually look at the overlap between all of these body systems and know that the whole is always greater than the sum of its parts. So a good example of this would be the relationship between the gut and the nervous system. A lot of people know that the gut is actually our second brain. But if you were to walk into a conventional office and complain of heartburn and depression, more than likely you'd be walking out of there with an antacid and an antidepressant. But most people know that depression is not a deficiency in Prozac. So in functional medicine, we look for the links between symptoms and then use a systems-based approach for treatment. Now, this would look like looking for inflammatory food groups in the diet, or testing for genetic predisposition for inflammation, or looking for environmental risk factors that could be setting this whole thing off. Now, we're all for treating symptoms if it's going to relieve suffering in the short term, but in the long term, we really have to dig deeper and find the root cause of an illness if we want true healing. In this regard, conventional medicine is probably about 30 years behind. In especially the past 2 decades, medical science has blown up. There have been just amazing advances, and we now know way more about how the body interacts with the environment and what produces health. So while functional medicine will honor the fundamental science of conventional medicine, it also incorporates this new medical science, and again, we'll use that systems-based approach to provide a really potent and holistic form of care.